Good afternoon and welcome to the fifth session in the TPP Hospital webinar series showcasing the modern EPR. The aim of this series is to showcase how TPP is supporting the frontline digitisation requirements for NHS trusts through the SystmOne Hospital EPR and to show how our future-proofed platform has been designed to meet the changing demands, pressures and priorities of care delivery in the NHS. SystmOne Hospital is an out-of-the-box enterprise-wide solution which comprises of the following modules. Today's session is specifically about the SystmOne EPMA solution. SystmOne EPMA provides safer, more effective care. The advanced tools enable clinical teams to adopt safe prescribing practices, and prescribing and inpatient medication charts enable a fully digitised, closed-loop prescribing capability. Over the past couple of years, we have had various implementations of our EPMA solution in NHS trusts, but one of the most recent was Sussex Community Foundation Trust in some of their community hospitals. This is an example of some of the feedback that we received from nurses on one of the sites. As you can see, there's quite a bit of uncertainty prior to the go live. Obviously, it can be a really big change. Once they actually went live, nurses loved the system. They rated it 5 stars, and there are some really good quotes there on the right that shows just how much of a good change it was. Now, obviously, we've not got loads of time today, so if you do want to see anything in more detail or are interested in any of the other modules, we'll be hosting more sessions and have recordings available for all the previous sessions as well. These are dates that are booked in so far, but there will be more to come. The links can all be found on our website, or you can contact anybody from TPP to provide you the links and we'll get back in touch with you. So without further ado, I'll hand over to the product specialists.
Thanks for the introduction there. Hi everyone, my name's Simon. I'm one of the product specialists here at TPP. And today I'm going to be showing you the EPMA functionality within SystmOne. Now, SystmOne comprises a fully comprehensive EPMA suite, including electronic prescribing management, with the ability for inbuilt and user-defined clinical decision support, electronic stock control and ordering, as well as full pharmacy management and dashboard reporting. So as part of this demonstration, we're going to start by looking at on-admission medication. We'll then look at prescribing within the patient's record. We'll have a look at that pharmacy management, administering medication, onto formularies and formulary management, and then finally ending up on reporting. So first of all, let's have a look at on-admission medication. Accessing the patient's record, and with access to the rich shared EMR for the patient, I'm prompted that the patient has on-admission medication that requires review. I can clearly see the medication to be reviewed, and I can also see the medication source, in this case that it's come from the SystmOne electronic medical record. To carry out my review, I can do this in bulk for the on-admission medications. In this case, I'm going to choose to stop one of the medications, re-prescribe the other as regular, and then re-prescribe the other as required. The system will then prompt me to carry out the actions. I can choose the stop reason, and for the next medication, the Ramipril, I can choose from the drugs formulary built within the system. With the shared medical record, the system's then prompting me to check patient-specific warnings. I can then choose to proceed, and the details of the medication is then automatically populated from the formulary entry. We can also see that the admin times for the particular ward that the patient is on has automatically been selected, as well as the first admin time to be administered. Then on to the next medication to now prescribe as required. Again, I can check this medication against patient-specific warnings, and again, the medication is populated as part of the formulary entry. For as required, I can record when to give the patient the medication, as well as the frequency of when to administer. We can then see here's the salbutamol as an as required medication, and the on-admission medication is now marked as reviewed, and I can clearly see which medications have been re-prescribed as well as which medications have been stopped. I can then record or update the medication information source for the on-admission meds. Here we can see that the source is automatically selected as coming from the SystmOne electronic record, but I can also record a further source. This then updates the patient's record with the history checked. Within the record, I also have access to the action group timeline. I've got a full timeline of the action groups of the medications and when they've been prescribed. So following on from on-admission medication, let's have a look at prescribing other types of medication within the patient's record. So again, from the medication chart, Here I can see the medication that was prescribed for on admission, but I have access to a whole range of other medications that can be prescribed. For example, we can prescribe regular or once only, as required and variable dose. Other options include rate controlled and oxygen. We'll have a look at some of these options now. Now for inpatient prescribing, a VTE assessment can be prompted at the point of prescribing, and this will keep popping up until the assessment has been completed. Now this template forms part of SystmOne's clinical development kit, so the template is fully customizable by individual users or by the trust. So here I'm going to record a low risk, and this will be coded within the patient's record. Other types of medication include prescribing regimes. And regimes are really useful for prescribing groups of medications. Here we can see the regimes to select from, and I can search for the regime that I'd like to prescribe. In this case, I'm going to select the as required cyclizine. Now this is a once only regime. So although prescribing all 3 medications, I can only administer 1 within the regime. We can then complete the prescribing, checking against patient specific warnings, in this case duplicate therapies, and all of the information that's populating the prescribing screens are pulled directly from the formulary entry. And there we have it. We've instantly just prescribed all 3 types of medication where only 1 is to be administered. At the point of prescribing, I also have the option for suggested dose. I can select the icon from the dosing field, and the system will suggest dosage based on the medication that I've prescribed. And we can see that it's automatically based on information that's populated within the patient's medical record, including the age and weight recorded of the patient. I can then select the applicable suggested dose, and this will then automatically populate my prescription. As well as suggested dose, SystmOne also has dose range checking. Here we can see, based on the medication prescribed, the system has prompted the following warnings to the prescribed dose. From here I can then choose to continue or go back and complete the correct dose, performing a safety check to ensure that the maximum dose is not exceeded. I can then return to the medication and amend the dosage. Now SystmOne also has the ability for quite complex rate controlled medications. Here we can see I've selected a medication from the formulary. I'm going to prescribe some ectrapid, and I'm going to do that on a continuous rate control basis. But I also have the option for once only rate controlled or regular. Now the different dose rates have already been pre-configured within the drug's formulary. And I can then begin to fill in the rest of the information, including the concentration and the diluent. Now clinical decision support can also be used at the point of prescribing. Here we can see a protocol has been launched, and that's based on the type of medication that I've just prescribed, in this case the insulin action group. Now protocols again form part of our clinical development kit, so they're fully customizable within the system. Here I can select to prescribe a PRM medication based on the protocol. The patient has mild hypoglycemia, so the protocol has automatically selected the correct regime. In this case, the regime comprises of 2 medications, which I can also be selective of at this stage to choose the correct medication to prescribe. I can then complete the prescription, the dosage is automatically selected for me, and I can begin to fill in the first admin times. Now we've seen how clinical decision support can be used to aid prescribing. Next, I'm going to show you how protocols can be used to prescribe the correct dose for particular medications. So in this example, for gentamicin. Now the protocol is going to be launched manually, but this could be automated as well. As part of the protocol step, I'm going to enter the latest result for serum creatinine. And then based on information in the patient's record, including their age and their last recorded weight, the creatinine clearance is automatically calculated. I then simply click OK to prescribe the initial gentamicin dose, and the dosage is automatically selected for me. As part of the protocol, the final step is the system is automatically adding a to-do list item to the patient's record. This can then be viewed from management screens within the system, including the ward view and the inpatient overview. You can also notice that medication can be highlighted on the patient's medication chart. So here we can see within the ward view And we can see that to-do list item for the gentamicin has been automatically added to the patient's to-do list. We'll now look at prescribing EPS. So we've concentrated on inpatient medication, but we can also prescribe outpatient medication as well. Again, selecting the medication from the drugs formulary, I can record the dose and the frequency as well as all the other information as part of the prescription. For this prescription, an EPS prescription can be produced. Here we can see the nominated pharmacy that has been pulled through from the spine. From here, I can then simply sign the electronic prescription with my smart card PIN. Now let's look at recording a drug sensitivity. So again, we're back into the patient's record and I can view the patient's sensitivities and allergies that may have been pulled from the patient's shared EMR. I can select the icon to record a sensitivity and then I can search for the medication that the patient has a sensitivity to. SystmOne supports toolman lettering to support searching for medications. I can then select the sensitivity, recording any further comments and the start date. On recording a drug sensitivity, SystmOne has automated yellow card reporting. The information recorded within the yellow card will be automatically sent off to the MHRA. Here we can record any further details to support the yellow card entry, including the current medication that the patient's taking. When drug sensitivities are recorded within the patient's record, and then I choose to prescribe a medication against this sensitivity, here I can view this from the patient-specific warnings for sensitivity to the medication. The system will then further prompt me to the sensitivity. Now, the system has the flexibility to allow prescribing against sensitivities or to disallow prescribing against sensitivities. And if I do choose to proceed, a fully auditable reason as to why I'm proceeding is then recorded. Now let's look at prescribing TTOs. So during the patient's admission in this case, we've been prescribing a lot of medication within the medication chart, but I have easy access to be able to see all of the medications that have been prescribed. I can simply select the medications that I'd like to re-prescribe as a TTO. Again, using the formulary entry, checking against patient-specific warnings, and the TTO prescription is automatically populated. And we can also see that an FP10 can also be produced at this stage. I then prescribe that medication as a TTO, and that will show on the TTO section of the medication chart. Now I also have the option to review the patient's TTOs against all of the inpatient medications. Again, I can choose which medications I'd like to re-prescribe, and again the medication is then easily prescribed based on the formulary entry. And from here it makes it nice and easy to be able to see TTO prescribed against the patient's inpatient medications. Now here we can see a visualization that allows me quick access to be able to prescribe various medications from the drugs formulary. Simply selecting one of the buttons will then prescribe the relevant medication. I've also got the options to provide a stat dose and also prescribe a TTO. The visualizations again form part of the clinical development kit within SystmOne and are fully customizable within the system. We'll now look at pharmacy management. As a pharmacist, or the person responsible for screening medications, I have a dedicated screen to see all unscreened medications. And you'll notice as well I can filter by patient or particular location. From here I can then access the patient's medical record, and I can use the fully customizable visualization to view information within the patient's record, including current and past medication. We'll also see I can prescribe medication directly from here, as well as carry out any further actions within the system. As part of screening, I'm going to access the patient's medication chart, and I can easily see which medications require screening. Once I've carried out my review of the medication, I can simply mark as screened, and this is all fully access controlled within the system. But the screening is fully auditable, and I can clearly see the audit within the medication chart. I also have the option to query medication. I can select the query option, and here we can see this will send an electronic message directly back to either the prescriber, the consultant, another staff member of my choice, or even to a whole group of staff members. I can then clearly see that the medication has been queried from the medication chart. Now, as part of my pharmacy checks, I'm also going to record the source of supply. And I can do this in bulk from the medication chart, simply selecting from the configurable list options for each medication type. Once medication has been prescribed, I have a dedicated screen to be able to see all pending medication orders. I've got options to be able to filter by dates and by locations, as well as for a particular patient. So in this case, I filtered by a particular ward, and I can process the order individually, or in this case, I'm doing this in bulk. So I can complete the order can then be completed, and the medication is then allocated to that individual patient. So then during administering, the patient's stock is automatically deducted. Digital dashboards can also be created within SystmOne. Here we can see pharmacy to statistics. Now these can be displayed within the pharmacy, and all of the numbers within the dashboard are updated automatically. So here I can see reconciliations and medication that's been prescribed perhaps in the last 7 days. But these are fully customizable within the system and can be used to display key information and KPIs for a particular department. So we'll now look at administering medications. Now from the ward view, an automatic alert is added to patients that have overdue medication. But as a nurse on my medication rounds, I can use the due medication screen to filter by a particular location or patient or a particular date. And from here I can see all of the medications that are due, including the ward round times. I've also got access to icons for particular medications where I can see there are infusions, oxygen, critical meds, and also medications that require countersigning. So from the due medication screen, I can access the patient's record, which will take me straight to the patient's medication chart. I can see the medication to be administered, as well as the full administration history for that particular medication. Selecting to administer, I've got access to a lot of information, including the patient picture and also the drug sensitivities and allergies. Now I can select to fully administer, I can partially administer the medication, and finally I can select that the medication was not administered for a particular reason. As part of administering, SystmOne supports GS1 barcode scanning, where I can scan the barcode of the medication, and we can see that the patient's stock is automatically going to be deducted, forming a full closed loop administration. And this then updates the patient's medication chart. Now in terms of administering PRNs, I've got the information to see when I need to give this to the patient and when it was last administered. And again, I can choose to fully administer, scanning the barcode and deducting the stock. Now SystmOne also supports countersigning, and I can see the reason why this particular medication requires countersigning. I can select the countersigner, and if the countersigner isn't available, I do have the option to send the countersigner a text message. The countersigner can then enter their unique PIN, and this will then be recorded and fully auditable within the patient's record. For administering rate control medications, I can record the mix details, including who the checks were performed by, the batch details, and the syringe driver number. At the point of administering, I can then start the rate controlled medication, and I'm automatically prompted to enter the observation required to calculate the dose suggestion. The system will then suggest the correct dose. I can select the mix as configured before, and I can then choose to start the medication. Again, if this medication requires countersigning, this can then also be completed. We can then see that the rate control medication has been started, and during the administration I can also record the observations. Here I can record the condition of the site and volume remaining, as well as test readings and, if applicable, epidural information. If any amendments are to be made based on new observations, I can record an amendment, updating the observation, and in this case the system is now suggesting an updated dose. I can then confirm the details, and again the changes can then be countersigned. Any changes to the rate can then be viewed directly from the patient's record through the observations information, with a full audit trail of any changes that have been made. We'll now look at formulary management. Throughout this presentation, we've seen how formularies can be used to easily prescribe medication. SystmOne allows for drug formularies to be configured to speed up the process of prescribing. Here we can see all of the formularies that I have access to, as well as the different types of medication that the drugs sit in. The drugs can be configured with the correct route, the dosage and the admin times to really speed up the prescribing process and keep prescribing standardised. As well as formularies, drugs lists can also be created. This allows for attributes to be applied to certain types of medication. So here we can see the types of attributes, including medications that require countersigning when prescribed or administered, medications that require approval, or even having a warning to display when medication is administered or prescribed. We're now going to look at SystmOne's clinical reporting. SystmOne has a fully comprehensive clinical reporting suite. From here we can see all of the reports that we have access to and that have been created within the system. Here I've created a report to find all patients on a particular medication such as methotrexate. But I can also find patients who require reviews of their medication chart, drugs that have been administered within a certain time frame on a particular ward, or perhaps antibiotics that haven't been administered within the correct time frame. So any of the information that we've looked at throughout this presentation can all be reported on through clinical reporting. Now the other benefit of these reports is they can also be published to organisation groups. So therefore other organisations within the area can also use these same reports. Simply running one of the reports, I can then see the patient within there, including all of their demographic information, and I can access the patient's record directly from here. I also have access to bulk action, so that's the icons towards the top of the screen. And this allows me to apply an action to all of these patients in one go. I have the option to export this information as well as break it down further if there's anything particular that I want to display. Now, as well as clinical reporting, we also have batch reports, so we can get these reports to run automatically for me on a frequent basis. And SystmOne also supports a daily extract of data through our SRE extract. And that completes our EPMA presentation. I'd just like to take a moment to thank you for watching, and we hope to see you on the next webinar.